January is Alzheimer's Awareness Month in Canada. And in Saskatchewan, there are 20,000 people diagnosed with Alzheimer's or dementia. Women are more likely to have the condition. And during the pandemic, caring for people with the disease is a challenge. Joanne Bracken is the CEO of the Alzheimer's Society of Saskatchewan, and she joins us now. Joanne, what has been the biggest challenge for people with Alzheimer's during the pandemic?
Well, I think, in general, Alzheimer's disease can be a very challenging disease for family members. And certainly during the pandemic, a number of the areas that people find really difficult, like isolation, became much more apparent. And in many cases, the regulations or the guidelines that were put in place to keep people safe, like physical distancing, increased social isolation for the person with dementia and for their family caregivers. And we know dementia is a very isolating disease. So that was extremely challenging for people not to be able to see their family members, and then also not being able to access many of the supports and services that were available to them before the pandemic.
So now, in some cases, people have seen upsides of the pandemic. Have you seen any upsides during the pandemic?
Well, I would say from an Alzheimer's Society perspective, certainly we embraced technology and we moved a lot of our programs and services online to be able to support people. And so that was a way that they could connect to the help and the information and the support that they need. So we certainly improved our ability to provide those services to people. And I don't know if it's necessarily an upside, but certainly the pandemic has made us aware of some of the challenges in long-term care that need to be addressed. And so there's heightened awareness about some of those challenges. And I think now is the time for people to be thinking about how we can better improve quality of life for people living in long-term care and providing better supports for people who are caring for people with dementia who are living in the community.
Well, that brings me to my next question. As the pandemic moves into the third year, what supports do you need from the government?
Well, I think, we would really like to sit down with the government and to develop a provincial dementia strategy. I think what we can do is acknowledge the things that are going well, but certainly to think about what are the areas that need improvement. And we'd like to be a partner with government and other stakeholders to address dementia care in Saskatchewan so that we can ensure that people can live well with dementia and have the quality services that they really deserve.
So now communities like Yorkton and Melville, now they've created dementia-friendly communities. How does that work?
So dementia-friendly communities is making a commitment to learn more about dementia. So 60% of people who have dementia live in communities. And so they're your neighbors, they're your coworkers, and hopefully they're your friends. And so what you can do to better support people living with dementia, to learn about and to be able to understand. And again, as I said earlier, dementia can be quite isolating. And sometimes families express that people fall away from them once they have the diagnosis. And I think it's because people don't understand the disease and they're worried they might say something that's offensive or, embarrassing. And so when you learn about dementia and you understand the changes that are happening for the person, then, you have the skills and the abilities to continue to support them and to help them to have a good quality of life living in the community.
Well, thank you so much for your time tonight, Joanne, and thank you for everything that you do for our community.
You're welcome. Thanks for having me.
Joanne Bracken is the CEO of the Alzheimer's Society of Saskatchewan.